Very important segment of our program. Maybe not as much fun as the last one, talking about ice cream, but Dr. Kevin Kavanagh is a retired physician from Somerset, Kentucky. He's also a founder and president of an organization that's nationwide now called Health Watch USA. Hey, good morning, Dr. K.
Good morning, Jack.
How have you been?
I've been really good, doing well.
Good. All right, let's start off with some good news. You know, sometimes we're accused of being a little too negative on this program. We don't mean to be, but sometimes we are. Now, this Pfizer product, tell us what you know about that.
Well, a bunch of good things. One is that the Pfizer product appears to work on the variant of the coronavirus that we have in the United States. That's the new variant, the UK, United Kingdom variant that's more infectious. And that is really good news. And that's the Pfizer BioNTech Vaccine. Also, we've got good news that Eli Lilly released their antibody trials. This is their monoclonal antibody product regarding the prevention of COVID-19 in nursing homes. So if you run out of vaccines, you could give the residents monoclonal antibodies, and similar to getting monoclonal antibodies for rabies, it would protect an infection from occurring in the future. And this was 80% effective in nursing home residents, 57% effective in nursing home facility staff. And this is important. And remember, they're looking at infection versus no infection. If you look at those who developed an infection, I would suspect the infection would also be much milder. So this is also very good news. And in Kentucky, although we had an extremely bad day in deaths, that's, I think, the worst day we had, which just a horrific number, over 50, our rates are steadily dropping. A week ago, they were almost 5,000, and now they are well below 4,000. Our positivity rate, even with testing going up, has dropped from over 12% to now 11%. So things are going in the right direction. So we need to keep on going how we are going and follow public health advice. And also this week, in fact, just yesterday, President Biden released a 7-goal national strategy, which really outlines specific measures to be taken, and more will follow. But in that, he will be evoking the National Defense Production Act in order to get more tests, more vaccine supplies, and to start to get the vaccines delivered along with testing supplies, et cetera, get these out to the people. So I think that this is very, very good news. We'll also have, I think, from this better outlines of when to open schools, what to do with businesses, and so it won't be a mishmash of uncoordinated policies that we're currently seeing. Instead, everybody will have a standard playbook which they can follow. A lot of these won't be mandated, doesn't have the ability to mandate it, but it will be good to have a standard, scientifically based playbook for individuals to follow.
That's great. That's wonderful news. And Dr. Fauci last night on television, I don't know if you saw it or not, but he kind of had the same attitude that we can't let down, but we're going in the right direction. So that's a good thing. Bill in Lexington on our Auto Tech Service text line says, where does Dr. K think the distribution is falling, and how can you get to the point where vaccines are being thrown away?
Well, there's two factors here. One is we have to get more people available to put vaccines in arms. This means beefing up the public health service. This means possibly mobilizing the National Guard. In this document of President Biden's, it did talk about getting the public health service more funding so that this can be done. The other factor, and this is also talked about in this document, is vaccine hesitancy. We need to get people out of the mindset that this vaccine is more dangerous than COVID. That's not the case. And we have seen some recent problems with this. For example, in California, they had over 300,000 doses, which are currently in storage because they don't want to distribute them because they had 10 people who developed a reaction to the vaccine, and that was 10 out of 330,000. No one died. Compare that to your chances of getting COVID in California. Very bad decision. You need to get these vaccines out. California, as you know, is just being eat up with this disease, which is why we need to be very thankful that we're in Kentucky. You also have had vaccines being thrown out because of difficulties in refrigeration. They have to be kept at a very specific temperature. Recently, Maine and Michigan officials threw out 16,000 doses of Moderna's vaccine, and that's problematic. That's 16,000 people that could have received it. And this was thrown out because of difficulties controlling temperatures. Pfizer vaccine requires ultra-cold. It's even harder to control temperatures. But there are new vaccines coming on the market that do not have that problem. They can just be kept in a refrigerator. Johnson & Johnson, for example. So I think that things are really starting to look up. If you look at the massive amounts of vaccines which have already been delivered, the problems with the delivery itself have been fairly small. And under President Biden's action plan, in 3 months, they hope to be doubling the amount of vaccines delivered into people's arms. And of course, that requires supplies. It requires making sure people know how to keep these current vaccines refrigerated and safe, along with being fresh and able to be used. And it also requires scaling up in the amount of people that need to be available to give the vaccines. And of course, in my opinion, all of this should have been done last year under Operation Warp Speed. There shouldn't have been any scaling up. The infrastructure should have been there.
News report on new results from Eli Lilly's clinical trial. Can you tell us more about that?
Well, the Eli Lilly clinical trial, that is the one that they were giving the monoclonal antibodies with an attempt to prevent COVID-19. In other words, this wasn't treating COVID-19 once you've been exposed or developed a positive test. This was to prevent it. And they had approximately 80% of the nursing homes patients were able to have their infection prevented. In other words, statistically, they would have developed an infection, but instead it was prevented. 57% of nursing home faculty. So, yes, we were right on target with that.
Well, that's good news, too. Now, is it the CDC has a new director, is that right?
Yes, that's correct. I'm not sure of her name. She is an infectious disease expert out of Massachusetts General Hospital. I think that it sounds like it's a very good choice. Hopefully we'll see a change in direction of the CDC. One of the things that really, and we've talked about this before, the CDC's, a lot of their advisements just weren't on target, especially the one where they stepped back from testing for asymptomatic carriage and next week started testing. Of course, we had the whole on again, off again, on again about wearing masks. All of this is fairly frustrating. And so hopefully the new director will be very resistant to pressures from industry, from politics, etc. Just look at the science. Just look at what it takes to prevent spread. So I think the CDC is going to get back on track.
Are we going to rejoin the World Health Organization?
The answer is yes, and I do think that is a good thing. Now, I'm telling you, the World Health Care Organization has a lot of problems. It is as much a political entity as a public health entity, but it is the only game in town. And unless we pay attention to other areas of the world and make sure that they're vaccinated, we're going to wind up in trouble ourselves. Case in point, you've got the Brazilian strain, you've got the South African strain, which may evade some of our tests. The Brazilian strain has been reported by an article in Science to cause reinfections. So this is very problematic. We need to help snuff out those strains in those countries before they come to our shores. In order to do this, we need to invest in those countries' public health structure and put boots on the ground. And so this is just going to have to be done. We cannot stay in our nation and get riddled by infections coming in from other countries without helping them to snuff it out. And to be quite honest with you, we did this a lot in Africa with Ebola, other dangerous diseases, and we're quite successful at doing this. So we do need to gear up with this type of intervention and surveillance, and that is of utmost importance.
Now, let's get to the bad news. Some glitches on Moderna's rollout. What's that about?
Well, yes, there was a number of glitches on Moderna's rollout, most of those related to vaccine storage. And this is one of the problems of our current vaccines. Moderna, that needs to be stored in a deep freeze. You have that in your house if you have a refrigeration unit that has a top lid that you open upwards, very cold. Down in the bottom, that's where you need to keep the Moderna vaccines. Those are not available in many doctors' offices. And the Moderna vaccine, similar to the Pfizer vaccine, it's a specific range of temperature. Can't be too cold, can't be too hot. And that's problematic. The Pfizer vaccine is even more problematic because it requires dry ice storage. And that's one of the reasons why you'll see the biggest medical centers more apt to use the Pfizer vaccine, and out in the rural areas, the Moderna vaccine, because the storage isn't as difficult to do. Also, the Pfizer vaccine has to be reconstituted. In other words, that vaccine has to be brought up to the regular temperature in such a specific way and then given fairly rapidly. It doesn't have a long shelf life, and that can result in also discarding vaccines, and vaccinations then are missed. And so this is very problematic. The new vaccines which are coming on board, these are much more easily stored. They can be stored in the refrigerator, and that will be very advantageous, providing that these vaccines can be as effective as our current ones. The big advantage of Pfizer and Moderna vaccines is that it's totally made in the lab, and it's very automated. So you can type in the genetic sequence, the vaccine can be printed out, and they can have a vaccine to a new variant, or they can get a vaccine to the current variant that we have in extremely fast time. So that is just simply remarkable. And that's the reason why we're using these and using these so quickly, because they came on months before the other vaccines can be brought into market. So they're advantage, but also disadvantages.
What about schools reopening? Do you have any opinions or information on that?
Well, not yet. This is one of the things which are targeted in the guidance which is being given by the White House. And I think this is going to be good. It's going to have a standardized way of opening schools. I do believe that in our government, one of the things you can complain about House Bill 1, whether it was good, whether it's bad, but the one thing it does have is setting a standard to measure things by advisements through the federal government. And so this maybe will take it out of the politics of Kentucky and give us a set of plans to reopen. It does mention in this guidance that there will be expanded testing of schools, and I think that would, without saying, go along with expanded case tracking, so that we'll have testing of teachers, we'll have testing of students. Of course, the teachers are a high priority for vaccinations in Kentucky. Hopefully that will also take place. The one thing I didn't see in the guidance, and it could be there, but please, if it is, someone call in, because it's a big document, but I've word searched this and tried to read most of the document myself. I didn't see much on looking at quality of air, and I think that is very, very important that we look at air filtration, air sanitization. And, of course, getting good air quality is expensive because it means upgrading your HVAC systems or installing in-room, sort of towards the ceiling, ultraviolet light filtrations. But I think that's very important, especially with this new infectious UK strain that we have. We're not sure how it is spreading, but my bet is it's either spreading by greater survivability in the environment, such as on surfaces, or maybe it can aerosolize more. And if indeed it can aerosolize to a greater extent, then I think these types of interventions with air cleaning, air filtration are even more important. And that's not just for schools, but that's also for other retail establishments. Extremely important to have happen. And that I didn't find in the document. And so that is one change that I would suggest making.
We have a couple more texts from our Auto Tech Service text line. This gentleman mentioned last week that he had a friend's dad who left the hospital after 1 day, saying he'll tough it out, and then he's back after 2 days. Now they're saying they've got the family together saying goodbye. It doesn't look like he's going to make it. And this person says, we're all reconsidering our thoughts to not take the vaccine. And I think, again, we need to, as you mentioned, and have for months now, we need a good education program in this country just to make sure that the people that are skeptical get over that and go get the vaccine. Here's another one.
Definitely.
Yeah, here's another one, though, I want you to comment on before we run out of time. How is monoclonal antibodies administered? Is it just infusion in the hospital with doctor's prescription, or is there another option?
Right now, it is just infusion in the hospital with a prescription. It takes, I believe, a couple of hours sitting in a chair getting an infusion. And there are hospitals that are set up to do this. If you go to the Department of Health and Human Services website, go to the coronavirus page, you will find a link to finding infusion centers. I wrote a recent article, Infection Control Today, so if you go to Infection Control Today, you can see the article, and there's a link to how to locate an infusion center. But remember, you need to get your test back within 48 hours to get enough time to get the infusion, because you want to give this 3 days within diagnosis.
Okay. Another question from our text line. Can Pfizer and Moderna vaccines be made to not be so temperature sensitive?
Possibly, but it's going to take them time to figure out how to do it. Mm-hmm. I mean, what you saw them do was actually a decades of work. They've been working on this for a long time. They're trying to do that, but we'll just have to wait to see.
When you say decades of work, I think that sometimes can mislead people, because then people say, so the government knew about this thing a long, long time ago and didn't tell us.
Well, yeah, they knew about coronavirus. That's MERS, that's SARS.
Yeah, that's a lot.
All sorts of different viruses. Yeah. This was on their radar. The only thing they had to do was substitute a small amount of genetic code of this virus for the other viruses they're working on, and voila, they had a vaccine. And because it's all automated, they could do that within weeks.
Yeah, okay. But it's not a conspiracy.
No, absolutely not. This has been on people's, there have been scenarios of role-playing of what's going to happen if you get hit by this type of a virus. And that's called Crimson Contagion. That was done in November of 2019.
Okay.
Absolutely. We knew this was coming.
All right. Hey, always a pleasure. Have a good weekend. Talk to you Monday.
All right. Thank you, Jack.